As the COVID-19 pandemic continues to be a problem globally, much progress has been made in seeking solutions to this problem. One of the solutions is the use of a vaccine. Like many countries in the world, Kenya has begun rolling out the Oxford-AstraZeneca vaccine. This move has not received a smooth buying from the public. In return, it has raised many questions, one of them being why is the public resisting the vaccine? Yasmin Hamdan went out to the ground to find out why.
Unaweza kutambua kwamba umesikia about vaccine imefika chini ya COVID
na nimesikia hadi nimeiona kwa TV kileta leto.
Kama mwananchi wa kawaida, je, unaweza kuchukua hiyo vaccine au la?
Hiyo kitu blandastic. Pande yangu mimi siwezi jo. Hiyo kitu penye nasikia ati mpaka inafanya mtu anone sijui nini ati ni dawa sijui imetengenezwa na wachinku ama nimesikia hivyo. Hiyo dawa mimi siwezi kubali pande yangu. Na si ati nakupeleka kombo.
My names I'm called Hamali Protas, original names, and Protas rhymes are my music industry names, or stage names, what we call stage names. Yeah.
So the vaccine is now in the country. Will you take up the vaccine or not? And if yes, why? And if no, why?
Yeah, we shall have to take out the vaccines for the reason that Corona, since it came to, has affected many people. Not that it's just in the story, but we've seen some people they were being affected with the Corona and how it has let people down. So I think if they've brought vaccine to take it as a solution, to reduce the spread of it, I think it will be the best solution for us.
Chanjo ni mzuri, hatukatai. Lakini kwanza waanze na wakubwa kubwa. Wakikubali na sisi tutakubali.
Mimi naitwa Ann Mweni. Mimi ni mkaaji wa hapa Mathare.
So umesikia kuhusiana na chanjo?
Chanjo mimi nimesikia mambo ya chanjo na nimekatana nayo.
Kwa nini?
Juu wale wakubwa kwa nini wajanduka sindano? Hiyo wanapewa hiyo chanjo. Na sisi tunakuja kupewa chanjo sisi watu wa huko mitaa.
Naitwa Anastasia Njue. Mimi ni mama wa watoto 7 na wajukuu 13 na kitukuu 1. Naishi Mathare tangu kuzaliwa.
So umesikia kuhusu chanjo?
Chanjo nilisikia, niliona ikikuja, lakini hakista chanjo.
Kwa nini?
Sababu sijui umuhimu wake na sijaiona mtu mgonjwa corona huko hata mmoja.
From the voices on the ground, 3 things are clear. The public lacks knowledge on the vaccine. The public has been getting false information, and the public trust their political leaders more and want them to lead by example by taking the vaccine first. To assist you in getting the right information about the vaccine, Yasmin had a sit-down with Professor Walter Jaoko, a vaccine expert at Kenya AIDS Vaccine Initiative, KAVI.
Oh, thank you.
Maybe you can tell us on the importance of vaccine, first of all.
Okay, so vaccines are things that when given to people who are not infected, it teaches their body to fight against a germ, a particular germ. So vaccines are specific to a particular disease. So like in this case, you're talking about COVID-19. So when we are given a vaccine against COVID-19, it prepares your body to fight the infection, should it come across it.
There are a lot of speculations going around that the vaccine can cause infertility in women and men. Maybe you can shed some light on that issue.
No, there is no truth about that. The vaccines, before vaccines are registered for use in human beings, it goes through a lot of trials. It is tested first of all in animals, and then it is tested in human beings. In animals, we are able to, after giving the animals the vaccine, like usually use small animals like mice, we are then able to dissect them, to kill them, and look at different organs in the body to see if the vaccine has any effect. And it's only the safe vaccine in animals that are then tested in human beings. And the testing in human beings is done in stages. So you have stage 1, where you look at safety, stage 2, where you look at whether it's producing these things that we want it to produce to help the body fight infection. And then stage 3 is where we are able now to tell whether the vaccine is actually protecting people. So by the time you see a vaccine being given to human beings, it has gone through a lot of tests. So it will not cause infertility in either men or women.
Okay, people are saying that why is this vaccine out so fast compared to like HIV and AIDS, which has been there for years, and there is no vaccine for that?
So vaccines are, remember the vaccines are, as I said at the beginning, are very specific to a disease. Diseases are different. I think you'll ask the same questions. Why do we have treatment for malaria, but we have no treatment for cancer? So the fact that you have a treatment for one disease, it doesn't mean that you'll have treatment for all the diseases. And it is the same thing with the vaccine. Vaccines are made in very different ways depending on the disease that the vaccine is being made for. That is number one. Number two, I find that a bit strange when people ask about, you know, like many years ago, in the 1960s, it would take 3 months to make one car. Now with modern technology, we're able to make 1,000 cars in a day with technology. I'd wonder if the same people would say, you know, how come we used to take 3 months to make one car? Nowadays we're making so many cars in one day. So there's a problem with the cars that you're making now. I think the world is advancing, technology is changing, and so we are going to even be making vaccines in much shorter period of time because of the improved technology.
And why does the COVID vaccine has to be in 2 doses and not 1?
So each vaccine has, the way the vaccines are made, it depends on how the vaccine is made. It is the same thing with polio vaccine. We give 3 times. We have other vaccines like something what we call diphtheria vaccine for young children. It's given 3 times. But you have TB vaccine is given only once. So it depends on how the vaccine has been made. In this case, when you give the first dose, it helps the body to be ready. What in medicine we say it primes the body. And after a period of time, you give the second dose. It's called a boost dose. So the priming is making the body ready. And then when you give the second, it now increases that body response. So that is why it's given. And there are some vaccines that have been designed that you give only once.
Okay, maybe you can tell us, we've heard that people are saying that it's Bill Gates' agenda to reduce the world population with the vaccine.
Yeah, now this is, the problem we have today is with the media. What we call the social media. Today I can create any story and put it in social media and it will spread like wildfire. There is no truth at all. First of all, there are many vaccines. It is impossible for Bill Gates to be making all the vaccines. At the moment, we have about 7 vaccines that are being used, 1 in Russia, 3 in China, and then the rest of the world at the moment are using the 4. So if you add that, it would be 8 vaccines. Now tell me how Bill Gates would be involved in every vaccine. And so I've seen all these things in social media, but there is no truth in it. None of the vaccines that are being used have been made by Bill Gates. They're made by different companies. There's one company called AstraZeneca, the one we're using here. There's another country called Johnson & Johnson. There's a country called Pfizer. There's a company called Moderna. They're not Bill Gates.
Maybe you can tell us how safe it is to use the AstraZeneca vaccine, which has been banned in almost 8 countries in the European Union.
I want to correct that. It has not been banned. I think that is a message that people need to understand. What happens with any vaccine is once you've been given a vaccine, anything that happens to you, we think it might be related to the vaccine, so we investigate. Let me give you an example. If you get a vaccine today in Kenya, let's say we've given 1,000 people the vaccine and 10 people have fever. So they have very high temperatures. We will say that probably it's the vaccine that is giving you this high fever, but then we investigate. So when we investigate, we find that out of those 10, 3 people have malaria, 3 people have typhoid. So we know that the vaccine is not the one that caused the fever. So what has happened in Europe, they have noticed that there's some people have clots, but we know that blood clots occur with or without vaccine. So even if they were not vaccinated, they would have developed blood clots. So we need to investigate. How do we investigate? So for example, you take 1,000 people who have not been vaccinated and you see how many of those have blood clots. Let's say for simple argument, you have 10 people with clots and then you take 1,000 people who were vaccinated and you find 7 of them have the clots. Then you know that the clots are happening without the vaccine. So it's not associated. That is what Europe has done. They have paused to investigate and then they continue.
Okay, many people, Kenyans generally, they say that they have survived the COVID pandemic last year. So why is there need for them to be vaccinated?
I think it's the same argument you'll say for children. I can imagine a mother saying, my child has not had polio, why should my child be vaccinated? So the idea of survival, that is the whole idea of getting a vaccine, because no matter how long you have survived, it doesn't mean that you'll continue to survive. That is number one. Number two, a vaccine reduces your severity of disease. So if you get a vaccine, and in the event that you still get COVID, it will be mild. It might even be asymptomatic. It might be mild. You'll not require to be admitted in a hospital. You'll not require to be put on oxygen. You'll not require to be taken to ICU. And it will prevent you also from getting death. So I think the people who say they have never had COVID, so therefore they don't need a vaccine, are not understanding the reason why people get vaccine. If that was the argument, no mother would take their child to be vaccinated against measles. They'll say, oh, they've never had measles, they've never had TB, they've never had polio. So the vaccine is to prevent. You don't wait until you get a disease. That's when you say you need a vaccine.
And why is it not safe for expectant ladies to get the vaccine? And also those people who have had COVID in the past 6 months, they say that they should not be vaccinated.
Okay, so there are two issues there. Number one is for the pregnant women, because this vaccine has not been tested in pregnant women, and it is for good reason. There is no drug or vaccine that is tested in pregnant women. In fact, if you had the same people asking those questions, if they heard that a vaccine was being tested in pregnant women, then they would be the first one to say, oh, why are you testing it in pregnant women? For that reason, because it has not been tested in pregnant women, and it has not been tested in pregnant women because we don't know whether it is going to have any effect on the unborn child. So we don't do testing of drugs and vaccine in pregnant women. That is why it's not being given in pregnant women. And what was the second question?
And why those people who are infected with COVID-19?
Okay, so now that is what the Kenyan government has decided, but there are other countries where it's not the case. You just vaccinated, whether you've had COVID or yesterday you recovered, or even if you have COVID and you have no symptom. The only thing that many countries are doing, anybody with disease symptoms do not get the vaccine. But that is not unusual. Even children, when they're taken for vaccination, any child who is sick, has a fever, they're not given the vaccine. So the government of Kenya has decided it is 6 months from the time you recover. That is when you get a vaccine. But there is no danger getting the vaccine, even if you've just recovered.
And is it safe for people who are suffering from long-term illness like cancer? Are they able to get the vaccine?
Okay. Actually, that is why this vaccine has actually even been made. We know that people with cancer or diabetes or high blood pressure, when they get COVID, it is much more serious and it leads to a lot of deaths. When the vaccine was being tested, it included people with those conditions, people with diabetes, with cancers, and so on. So we know that the vaccine is safe in those people.
Okay. You are in the helpline. Have you been vaccinated?
Oh, yes, I've been vaccinated.
Maybe you can tell Kenyans.
I was vaccinated on Friday. On the first day when the vaccine was launched on 6th of March, I was amongst the first people to be vaccinated. I only had pain at the site of the injection, which disappeared in about 3 days. But that is my experience. There's some people who have developed some fever. There's some people who have had some headache after getting the vaccine. But the ones that I know, in this place, the organization where we're working, majority of the people have had very mild symptoms.
So can you advise Kenyans to get the vaccine?
Oh, yes. I always say this, that the choice to get a vaccine is yours. What people need to know is to know the facts, and then they choose. As the president said, nobody is going to be forced to take this vaccine. So our responsibility is just to explain to people what the vaccine is, the potential side effects that you can get, which is joint pains, fever, feeling tired, headaches, pain at the site of the injection, and then you decide for yourself whether you want to have it or not. My recommendation is have it, but the choice is yours.
Thank you so much, Professor.
Mm-hmm. Thank you.
#pamoja dhidi ya corona, #baki salama. Thank you for watching. I have been your host, Yasmin Hamdan.